My name is Daniel McIntosh. My presentation today is titled, Is Alcoholics Anonymous Effective? And I will cut to the chase and say, yes, it is. And I'll give some evidence supporting that. I'll also speak briefly about a couple of other facets of treatment of patients with alcohol use disorder, or what is commonly referred to as alcoholism. So, to understand the magnitude of the problem of alcohol use disorder, there's hundreds of statistics that you could turn to. I just chose one that I thought was particularly uh, illustrative, which is that alcohol use disorder kills 10 times more people than all illicit drugs combined. And so when we think of something that gets a lot of attention in the media or the public, like, for example, opioid use disorder, that has killed many thousands of people and is a true epidemic, it is useful to keep in mind that alcohol kills many more people. And I would imagine that the reason alcohol doesn't stay at the front of our mind is because it is such an old problem, that it is something that humanity has struggled with for thousands of years, ever since really we figured out how to ferment alcohol. So, in the treatment of a patient with alcohol use disorder, there are a number of mainstays of treatment, and most patients who succeed in their treatment of the disorder use some combination of them. It's not usually there's a single magic bullet that makes it all better. It's usually going to be some combination of these mainstays. And the first three sound similar, but they're actually different. So counseling in this case refers specifically to alcohol use counseling. So you have a professional who's trained specifically in counseling about alcohol who is treating the patient. Mutual help groups, now that is the one that refers to things like Alcoholics Anonymous, other 12-step programs. There's actually a number of different recovery programs that have cropped up, especially in the last decade or two. Therapy in this case refers to what we would traditionally think of as mental health treatment, things like one-on-one cognitive behavioral therapy, things of that nature. Medication, there are a number of medications that are used, some on-label, some off-label, and I'll speak about one at the end of this presentation. And family treatment is available with two popular options being Al-Anon and Alateen. So just a brief sidebar, there's a useful tool that I came across for primary care providers when they're seeing a patient to screen their patient for unhealthy alcohol use. And there was a specialist who recommended this as her preferred tool for screening. There are several screening tools, but most of them include several questions or several parts. And so a provider either needs to memorize each of the parts, or when they're face to face with a patient, they would need to consult a reference of some kind to go through the screening tool. So the benefit of this screening tool is it's only a single question that's very easy to remember. And the way it works is, so if a provider is seeing a female patient, they would ask, how many times in the last year have you had 4 or more drinks in a day? That's it. If it was a male patient, it would be 5 or more drinks in a day. And if the answer is anything other than never or none, 0, then that is a positive screen, and it opens the door to more detailed screening, or going as far as the full diagnosis using the criteria in the DSM-5. Tool is also very useful if it's negative. So if the patient says, I've never had that many drinks, then they're very unlikely to have unhealthy alcohol use. It doesn't screen for alcohol use disorder, it screens for unhealthy alcohol use. So if they say no, They probably don't have that problem unless something else in the interview um, concerns the provider, and then they could screen in more detail. All right, so back to the topic at hand. Is Alcoholics Anonymous effective? And the main piece of literature that I would like to discuss was just published, and that's why I chose this topic. It was just published last month by the Cochrane Review, who are often looked to as the gold standard in evidence-based medicine, because they will look at the body of literature on a subject and go through studies with a fine-tooth comb um, to create the most comprehensive and evidence-based product that they can about a subject. So last month, they came out with this publication looking at the efficacy of Alcoholics Anonymous and other 12-step programs like it. And the short answer is that they found that they are very effective, and in fact, in some ways, more effective than any other treatment. So a provider who's seeing a patient with alcohol use disorder can feel confident and supported by the best current evidence when they refer the patient to a 12-step program. That they're doing right by the patient, that they are doing the best they can to help them with their disease. So in the Cochrane Review, they slice and dice the different studies and look at a lot of different data. I just pulled out one, which is the percent of patients who have completely abstained from alcohol 1 year after starting treatment. And in the Alcoholics Anonymous group, 42% of them had completely abstained at 1 year. And in all other treatments, they were at 35%. So a 7% increase in the AA group, which is not enormous, but is also significant. One thing that jumps out at you about these statistics is that less than half in both arms remained abstinent. So especially in the non-AA treatment group, almost 2/3 of them were drinking some amount at 1 year. And I think that really illustrates the difficulty of treating this disease. And it puts both the provider and the patient, if they know these sort of statistics, it puts them in the frame of mind to know that treatment is likely to include setbacks and relapses, and that is okay, to not become overly discouraged or disheartened if they are to occur, and just to know that it is a long and difficult disease to treat, but that success is possible. A couple of other statistics that the Cochrane group found, looking at all the literature, they found that AA also leads to greater abstinence for up to 3 years compared to all other treatments. And they hypothesized that this is because 12-step programs emphasize continued membership, continued activity for life, really, but definitely for years past the point when a patient has stopped struggling with overt alcohol use disorder. And so they think that might be why it has a long-term benefit over other interventions, such as, for example, cognitive behavioral therapy, which is a lot more problem-focused and gives people tools to address their problems. But then once the overt signs of the problem have gone away, then a lot of times the treatment is withdrawn. And AA does not do that. And a few other aspects that the Cochrane folks found that AA was equally good at other interventions, not better, but equally good, are at reducing intensity of drinking, at reducing negative consequences, and that would include both social consequences like loss of jobs, loss of relationships, and also physical consequences like liver damage or gastrointestinal bleeding. Um, and that AA was also equally good at reducing severity of addiction. All right. So one reason that this recent review is so important is because it is essentially replacing a 2006 review by the same group, by the Cochrane Library, that found the opposite. So at that time, the same group, even several of the same authors, looked at the literature that was available to date in 2006, and at that point, they found no studies that conclusively demonstrated that AA was effective. And that was a review that relatively got a lot of publicity and was well known in medical circles. And so, ever since that review came out, it had left a little bit of a stain on the reputation of 12 step programs as an effective treatment for alcohol use disorder. And so, in the years since, many more studies have been done. And so, it is a great benefit that the Cochrane Review revisited the topic, looked at all the data from the years since 2006, and came to an opposite conclusion. And it's the conclusion that anecdotally has been supported by many providers and patients and just people in the community who have seen 12 step programs be effective for treating alcohol use disorder. All right, so just as one last little facet of treatment that I would like to speak about is medical treatment, pharmacological treatment of alcohol use disorder. There are a number of medications that are available and helpful, but I would like to speak specifically about naltrexone. And the reason I would like to speak about it is because it appears to be underprescribed. Um, that it is prescribed to only 9% of patients with alcohol use disorder who want medication for it. So a lot of patients with alcohol use disorder say, I don't want to take any medicine. I only want to do the mental health, psychosocial, those kind of treatments. But amongst the patients who say, I would like to take a medicine to help me with this, only 9% of them are prescribed naltrexone. So the way it works is it reduces the pleasurable feelings that people get when they drink alcohol. And speaking of its efficacy, there's a helpful statistic called the number needed to treat. And that is where a provider can say, okay, so if I treat this many of my patients, how many of them do I have to treat in order for one of them to have the benefit that I'm looking for? And so, in the case of naltrexone for alcohol use disorder, if a provider treats 12 of their patients, one of them will never be a heavy drinker again. And if they treat 20 of their patients, one of those 20 will never drink any alcohol ever again. And those NNTs are actually very good compared to a lot of common medicines. For example, statins to prevent cardiovascular bad outcomes in patients with known heart disease, you have to treat about 80 of them in order for one of them to not have that bad outcome. So these numbers are actually quite a lot smaller. Um, and naltrexone is typically an oral medication, but there is a monthly injectable. The benefit of that being that you can ensure compliance. The downside of it being, let me just move my screen over and you can see the price of it, very pricey. All right, so thank you. That is my presentation. And I hope you've enjoyed it. And thank you for your time.